We'll be starting, we're going to give it another, say, 2 minutes or so, because we've got more people joining. So I'll come back to you and to give an introduction. I'm sorry, my name is Tony Ross. I'm the Director of Communications for Provalis Research. I'm going to be assisting Abby today. And we have a bunch of people that are still sort of in the queue to join. So we're going to give it about 2 minutes and then we'll start. Okay, welcome everybody. Good morning and thank you for joining us for our first Lunch and Learn. I'm Tony Ross, the Director of Communications at Provalis Research. We have 3 more of these events scheduled in June. There's a good chance that we'll take a break in July and start again in August, but we'll see how things go, and if there's still a good demand for these events in July, we'll probably continue them. You can register and see the schedule of the upcoming events in the Learning webinar section of our websites. The title of today's presentation, as you can see on the screen, is The Danger of Assumptions, How to Use WordStat Inductive Research Tools to Build a Much More Reliable QDA Code Book for Content Analysis. Our presenter is Abby Jones. Abby has 10+ years of experience with QDA Miner and WordStat. Her expertise includes design and analysis combined with teaching research methods at 4 universities to offer customized research services. Abby offers consulting, research design, and training services through her company, AJ Research. She's a Provalis Research trainer. She can also take your already obtained information such as focus group responses, news coverage, or large documents and return a professionally written research report to you. At the end of the presentation, if you wish to ask questions, please send them to us through the chat feature, which you can see the little bubble at the top right-hand corner of the screen. We'll take as many questions as time allows. And if we can't, you can send us follow-up questions at support@provalisresearch.com and we'll try to answer them. And now I'll turn the presentation over to Abby.
Thank you, Tony. It's great to be here with everybody out there in the universe. As Tony said, I've been using Provalis Research for over 10 years. My graduate advisor, Robert Entman at GW, brought the program to us, and we have had an amazing relationship with Provalis. Sometimes they have been so insightful for us. Sometimes we've been a team member to help them build their program too. So I'm very excited to be here today. On the screen, you'll see some data, some results from a research project. It's the kind of thing you see all the time at research conferences, in research articles, all kinds of places, in newspapers. You see this kind of data. And we use it for policy making. We use it for large-scale decision making. We use it to guide our knowledge about the world. But for me, what I'm going to talk about today is some of the best ways to create this data so that you can feel confident in your results. Because often we are a little uneasy at the end, being very definitive in what we find. So I'm going to show how to get to this space. I'll come back to this picture at the end. So I wanted to do a very relevant research project for today. And so jumping off actually a guest commentary I wrote in the Citizen newspaper last week, I looked at the media coverage of the Black community in relation to coronavirus, because Dr. Sabrina Strings, who's an associate professor at UC Irvine, talks about how the media has latched on to narratives about obesity and overweight and people being overweight and the high level of diabetes in the Black community. But there's not a lot of talk, she believed, about systemic racism and other issues such as employment and income discrepancies. So I, having quoted her, wanted to go backwards and look and see what the media actually was saying. Using Nexus Uni, which used to be LexisNexis Academic, I took articles from the New York Times, the Washington Post, and NBC Nightly News from March 15th to May 24th. I chose May 24th because it was the day George Floyd was murdered, and after that, the data got a little more wishy-washy about definitive coverage. I do plan to go back and look at that too. I'm excited to announce that Norman told me that from now on, with the new version of QDA, LexisNexis articles or Nexus Uni articles will go right into QDA Miner, and it's going to make the system much easier. Look at the terms coronavirus and COVID, coronavirus or COVID, and Black or African American. I did decide to leave in the op-ed pieces in my study because I believe that was an important part of the coverage. So I did my search, I imported my articles into QDA, and as you can see, I looked at the variables. Let me pull this down. I had variables such as outlet, date, section, and reporter. I chose not to import the headlines. It's a little bit trickier, although now it won't be, and I didn't need them. So I'm going to ask you to ignore the code book over there because we're going to get there. But I'm going to show you how. So instead, I'm going to take us over to content analysis with WordStat. I'm going to take our documents with us, only going to do descriptive analysis, and I'm going to cross over to WordStat. Okay. And again, I'm going to ask you to ignore what's on the screen for a second. As most of us know, WordStat is an inductive tool. I always tell my research students in college, it's like letting the documents speak for themselves. Instead of our assumptions, as in the headline of this talk, WordStat tells us what the documents actually say and what's actually there. I think this is a great benefit in creating a content analysis project because often our assumptions get in our way. Often our assumptions lead our projects. But as you will see, as the project progresses, there were things I had absolutely not thought of looking for in the coding that would have been left out if I had just created a deductive code book and moved forward. This way, I let the documents tell me what they have. So one of the first things I always do once I get into WordStat is to simply run a frequency. No dictionary, no anything. I just say, tell me what's there. So I'm going to do that, run the frequencies. Okay, so as you see, I ran the frequencies and we see what we in some ways expect at this time, nothing too shocking. And at this stage, what I would do is I would go through these words and I would take the ones that I'm interested in and I would put them in the root dictionary, just the basic dictionary. So let's say I wanted the word public. I would drag and drop it over into the root dictionary. Often in this process, I alphabetize the words by clicking right above them because I find that it helps look at words together, such as business or businesses, as you see, or bank or banks. I think this gives you a clearer vision of what's there. But you could also do it by frequency, of course, and you could just wander down the list. Now, what I do here is I take every word I think could be relevant to my project, and I drag and drop them to the root dictionary. At this point, more is better than less, in my belief. that you're just trying to figure out what words are there. So if you look at that list, you try to figure out what words matter in this, such as pandemic. You would drag and drop that. Very relevant word. But again, I always go with the more is better, and I try not to hold back. So once I've dragged them all, any word I want, into the root dictionary, I go to the extraction where I can look at phrases. So I go to phrases, and I've set my phrases at, I'm going to set my phrases at 2 to 5 words, and I do the same, exact same thing. I run the search, and phrases that I'm interested in, I drag and drop into the root dictionary. As you can see here on the phrases, the ones I've already chosen have been are highlighted. So so death toll I used in my research. So my goal is to take what is in the document and start the process of building a dictionary by putting all of the things I am most interested in into the root dictionary. I then go back to text processing, and I look at the root dictionary and everything I picked out. Once I have that root dictionary, I start to classify it. As you can see here, I look at the words and I come up with categories that the words fit into. I admit often this is the most laborious process, a part of the process, because you don't know what you have to think about what you have to think about the relationships, the relationships between what you have. But once you get this, it's going to be an amazing tool for you to use on this project, but also to use in the future because you can save your dictionary. So as you'll see, I came up with all the words that fit Black and African American. I used the coronavirus words to make sure I had the actual words. I looked at words I thought were specifically related to the coronavirus pandemic right now. Health words, race words, underlying social issues, and I had I wasn't exactly sure where to put others, and then that's the R word we just put in, public. So I created categories that the words fit into. Next step I took was to create rules that related the categories to each other. So as you'll see here, I used the words I said for Black, and I related them to the coronavirus words, and then I related them to the other categories, underlying social issues, health, other, racism, right, coronavirus specific. I related them so that I then had a list of paragraphs, as we'll see, that were just about those words. I related them by paragraph, and I said it had to be within 15 words. So let me show you the rules for a second. Add proximity rule. So here you just give your rule a random name. I'm just going to use XXX. And then you can use categories or words if you had a word you wanted to relate to the others. Or, right? And then you say where you want it. I said near, right? And then I chose another category. I said within the same paragraph, and I used 15 words. I chose 15 words. That's been something that our team at George Washington, where I was a doctoral student, we looked at sizes of paragraphs, and we found that within 15 words was a very good way to relate words to each other. More than that, they're pretty separate. So 15 words became our best practice. So I created these rules to try to see how these categories related to each other. Okay. I'm going to use the dictionary that I've created. I'm going to select items. I'm going to look at the rules. And I'm going to go back to frequencies. Okay, so here you see I had a big category that just related my black words to my coronavirus words, and I got 248. Then my more specific rules, where I looked at, right? I looked at black and coronavirus and those specific words that were death toll and words like that, health words, other words, underlying social issues, which was a big thing I was very interested in, and race. Okay. Here's where the exciting part comes in, or where my students start to laugh at me because I'm getting excited. You can right-click. Right-click is so important in QDA and WordStat. I never use right-click so much in my life. You can go keyword retrieval. So I'm going to look at black and the coronavirus words, and then the coronavirus specific terms that I came up with. Keyword retrieval. Now these are your paragraphs that fit the qualification of the rule. And you can go through and you can code these paragraphs using the code drop-down box. But usually at this point you don't have any codes because you're doing it inductively. So while here we see the codes I created when I did the project yesterday, you will be adding codes. Now, this is the part that gets interesting. When you create codes, again, more is better at this part of the process. Don't be afraid to add codes. You will see that certain codes fit, and then you'll have paragraphs that you'll say, that doesn't fit any code I have yet, and you'll have to come up with a new code. Okay, so if you look at this paragraph, right, more likely, that was the word I was looking for, right? More likely to be infected. Okay, so I created a code at the beginning that said disproportional impact. And that was a code that I used a lot. Again, more is better as you go along. Don't try to fit the paragraphs into the codes you've already created. It's always better to create another code and combine the codes as you go into QDA. But doing it this way really lets the document show you what's there, rather than you saying, I have 5 codes I'm really interested in. Maybe there's 15 that you haven't even thought about. Okay, I said that there was something in the data that I had never thought about. In the data, there is, I'm going to close this for a second. One of the things I discovered when I looked at the data was in the articles was that one of the things that's happening in the Black community is that men are hesitant to wear masks because they get looks and people think they're more threatening. This is not something I had thought about at all, I admit, but I found this as I went through the data. I found this as I let it tell me what was there. So I very much encourage you to put away your preconceived notions of what you're looking for and instead let the document tell you. Okay, so going back to text processing and going back to our dictionary, right? You can use the rules or you can use the words, of course. The same thing happens if you're interested in, let me scroll down, not up. If you're interested in underlying social issues and how they appear, you could look at very specific ones. If you're very interested in income, you could check that and run the frequencies. And that's going to give you 36 paragraphs that relate low income, right, to our topic. You could also, of course, create a new rule that relates low income, right? I'm going to call it low income Black coronavirus. I'm going to take a Black word near coronavirus, same paragraph, 15 words, near, what did I say? Low income. I'm going to type that in. Low income. Low income. in the same paragraph. You have 15, right? And I'm going to add, oh, you know what? I'm sorry, I'm going to have to go back for a second. I apologize. Oh, wait, actually, I'm going to add it. One of the things you have to do, though, is make sure it's in a separate folder, or it will circle around on itself. So I should have originally put this in the rules. I'm going to drag that down and put that in the rules. And then I'm going to choose it. Choose it. I apologize. I'm having a little bit of technical issue here. There we go. And I'm going to run the frequencies. No matches were found in this. It happens. And I purposely showed you that. It happens. But if we were just using our assumptions, if we were just looking for something that we thought was there, it might misguide our research. That's why I think this process is important. Okay, so text processing. Going back. So looking at rules allows us to see what connects to each other. We could create a rule that connected low income just to coronavirus, and we could see if that connects. Okay, so I'm going to choose that. And run frequencies. So it didn't come up either. So this is to show you what we think is out there may not be, right? We have to be very careful about our assumptions. Okay. Once you have done all your coding from the paragraphs, as we saw, right? We right-clicked, we pulled up the words, we coded them, we were generous in our coding with how many codes we added. We didn't hold back. We didn't try to fit things in square peg in a round hole. We were very generous. Now you have your codes. Okay, so at that point, we go back to QDA. So we leave WordStat behind. Yes. And we see all our codes magically appear in QDA. So all the work we did in WordStat is now in QDA, in the code book on the left-hand side. We see the disproportionate impact. We talk about underlying health issues and diabetes. There were political issues that appeared in the data that I definitely had not assumed would be there. As I talked about, the mask wearing issues, this was quite surprising to me. Okay, systemic racism obviously is important. Social structural issues. This all came out of that system I just showed you, of coding the paragraphs that came up with each term or each rule. So we know that they're there. We're not searching for them. We know that they are there. Now, one of the great things about having this code dictionary now is that for coding reliability, you can give 50 or 100 articles to somebody else and have them use your code dictionary that you created to do their coding. So they will be using a different process than you, but the same data and the same code book. to see if you have substantial agreement. So I find that a very reliable process and very rewarding to be able to say, we looked at it in 2 different directions and came up with this data. Okay, once we're at this stage and the coding is there, let me show you. Disproportionate impact. If you, again, right-click and you retrieve the segments, these are the paragraphs. If you hit up here, you get the whole paragraph. These are the paragraphs that were coded as saying that the Black community was having disproportionate impact from COVID or coronavirus, depending on what you call it. You could also go through these paragraphs if you wanted to and feel very sure, a second check. Okay. So once we have the coding, now we start the analyzing process. So we're going to analyze the coding frequency. Okay. And I'm going to look at all of the codes to see where they're at. Okay. Then I'm going to choose the ones I want to compare. Select items. I'm going to look at underlying health issues. I'm going to look at non-health reasons. I'm going to look at social structural issues. I can click all because I want all of those. And I'm going to look at systemic racism. So these are reasons people talk about for the Black community being at disproportionate, having disproportionate impact. And so I've chosen what I want, and I'm going to go up to this. I've decided I really like circles. And there's our data, just as I started at the beginning. Data created through an inductive process, as I showed, to create a coding book that you can be confident in, and you can be sure that you know the data is what you think it is. You can look at frequencies or a number of cases. That's what I really like about this. Now, other ways to do this, to look at the data, is you can combine and look at different categories always, or you can look at the individual terms. I'm going to go to the political. I'm going to ungroup it. I would like to look at the political and say, what are they talking about politically? So I'm going to go to Analyze, Coding Frequency. I'm going to choose all the political. I'm going to search. Oh, there's not going to be many. Okay, so that the count, if you look at the count, it's very low. So it's not going to give us as much in terms of wealth of reporting. Okay, so at that point I decide I'm going to go back, and I can look at how health versus non-health issues are combined. I'm going to look at that. Virtual grouping. I'm going to group them together. Grouping. I'm going to analyze. All. Search. Okay. Again, this gives us great results. And I can look at this. I can say select items, health issues versus non-health issues. I'm not. Okay, so if we look at it in that direction, we see health issues versus non-health issues. But again, we didn't include in the non-health issues the social issues that we talked about before. So I can include that. Hold on, sorry. Hold on one second. I'm going to virtually group them. I forgot to do that. You have to virtually group here. And then I'm going to go to Analyze and Coding Frequency. And search. Okay, so I am going through the same process. Again, I can select items by right-clicking. I can look at health issues, non-health issues, and social structure issues, and compare those. Not sure why the circle is not working, but we have great comparison there. So there are different ways to compare the data once it is created to make those charts and graphs that people go, ooh, ah, oh, at conference. I always love that, is that you put up the picture and you get the most oohing and ahhing. I want to return to why the process that we've talked about today is important. I am a white scholar from upstate New York. I grew up in a very white area, and here I am doing a project on the relationship between the Black community and its relationship to coronavirus and how it's being covered in the media. Clearly, my preconceived biases are going to get in the way. Clearly, my ideas of what a coding book should look like will impact my project. But by using WordStat, by going there and doing what we did, which was look at the frequencies, choose the words from the frequencies, then take the words we had and put them into categories, use the categories to create rules, and then code those paragraphs, we can be much more certain of what we bring back to QDA to then analyze. We know it's there. We haven't used our preconceived notions to adjust the data to fit that square peg into that round hole. This is absolutely what's in there rather than what we think should be there. Okay. I'm going to stop there and actually let people ask questions. Tony?
Yep, thank you very much, Abby. We'll now take your questions if you have questions. So please use the chat feature as the button at the or the circle in the upper right-hand corner, and we'll take your questions for the next little while. Amos has a question. Do you plan to make a video? Yes, we've recorded this event, and we will be posting it on the website, so you could go back and look at it again. Abby, how many articles are in the study?
There is, hold on one second. There was 482 articles. Again, this is going to be a small sample because it's a small time period. I've done this exact same kind of project with thousands and thousands of articles. That's why the rules very much help take a large corpus of information and shrink it, for sure.
Okay, thank you. Another question, why do you use only the near rule in rule creation instead of some of the other functions?
In this case, because I don't want to, it doesn't matter if it's before or after, which is, I'm going to go to that screen for 1 second. Hold on. Okay, so the options there are, and, so if you only wanted it to be within, it didn't matter to you distance, right? You didn't want it, is not near or not near. And to me, it didn't matter the order, before or after. It didn't, that in this project didn't matter. I have done projects where, because we were looking at framing more, we wanted one word before another or one word after another. So I have done projects where I've used that rule.
Okay, thank you. Were the articles you got, were they in PDF or text format?
LexisNexis allows you to download them both ways. I always download them in MS Word because until the new version comes out, you have to import your variables. Now the new version is coming out, maybe Adam or Tony knows whether you'd be able to use PDF. I'm not sure.
I believe, yes, you can use PDF.
So
Another, I don't know if you know the answer to this question, Abby, and Tor, if she doesn't, we'll get back to you directly. But a lot of my, because we can do this, but a lot of my raw data comes from tweets, contains emojis, emoticons, hashtags, abbreviations, LOL, etc. I haven't found a good way of dealing with these issues. Do you have any suggestions?
I am going to let Normand and Adam get back to you on that. Things like LOL, WordStat will pick up for sure. Emoticons and that kind of thing, I actually haven't dealt with. I don't study tweets myself and haven't had a client who has either. I probably will in the future and have to learn that myself.
And Tor, just so you know, yes, you can analyze those in WordStat, and we'll get back to you. We'll get back to you specifically, but you can convert the emoticons to the text equivalent. And I'll send you a link of where that is explained and how you can do that.
Tony, CC me on that too. I'll learn something new.
Okay, that's good. Do we have any other questions? What types of data? No. What was your one other quick question, if you know the answer? Because I didn't see it. What was your total word count? Do you recall?
I don't. I apologize. I'm not sure. I don't have that. That's something I've ever written.
And did you actually code all the paragraphs?
Well, I coded the paragraphs that fit the roles. Yes, okay. I coded all 482 articles. Yes.
Okay.
And if I wanted to go back and show, hold on one second. I wanted to end with this. If you look at this data, it's very interesting because it does, when you talk about what is in relation to COVID and the Black community, Dr. Strings was correct that the underlying health issues, including diabetes, dramatically, is the narrative that the media has most logged on to, attached itself to. It is talking about other issues. I have to say I was somewhat not surprised, but maybe pleased that they are talking about healthcare issues, including access and quality, and the lack of that in the Black community. But again, you see, you see over a quarter of the coded paragraphs talk about underlying health issues. And Dr. Strings argues, and a lot of other scholars out there argue, that this is a blame the victim narrative that comes along a lot when it comes to the Black community and health issues. So it's this little study, and it is a small study, 482 articles. I'd like to expand it using other media outlets, but it does fit what scholars are talking about and what scholars have talked about in the past. So it does fit the scholarly knowledge about this issue as it goes.
Okay. Okay, I have a question that I can answer. For those of us who have just started, are there videos or a plan for future or other webinars? I'm sorry, I don't. Mauricio, I think is your last name. I have a little bit of difficulty with your first name. Yeah, the answer is yes, yes, and yes. If you go to our website, under the resources section, we have about 60 tutorial videos that you can look at that can help you learn the software. We also have previously recorded webinars on the resources section. And we are going to be doing 3 more of these lunch and learns on different topics that are scheduled through the end of June. We may be taking a break in July because people are on holiday and starting up again in August. We still may do 1 or 2 in July. Haven't exactly decided yet, but we will be doing them in August, September, October, and hopefully through the fall. And we'll be trying to do 1 a week. The one that we're going to be doing next week is with Professor Derek Cockburn, and the title is Entity Extraction and Topic Modeling with WordStat. Derek is a professor at American University and does a lot of work with the UN, and is extremely proficient in the use of WordStat. There are a few other questions here. They're more technical and they're more sort of general use questions about the software. We'll take them into account, and we'll try to get back to you individually. You can also please send us any questions you might have to support@provalisresearch.com. Also, if you have any suggestions about, yes, by the website I mean provalisresearch.com. If that was just an answer to somebody's question. Also, if you have any other suggestions about different subjects that you would like to see us cover, please send those along too. If you have a subject that you would particularly like to present, we're also open to suggestions along those lines as well. So I think for now we'll wrap this up today, and I'd like to thank Abby very much for your presentation today, Abby.
Thank you.
And thank everybody for participating, and we will see you next week.
Can I add, Tony, that if you have questions about my presentation specifically, there's my email, and I'd be happy to talk to anybody.
Okay, so Abby's email is there on the bottom of the slide. The other thing I would add is you can get Abby's contact information on our website, provalisresearch.com, under the training section. Abby is one of our trainers, and her bio and all her contact information is there, so you can get it. You can get it there as well. Okay. So thank you, everybody. Have a great rest of the day. Stay safe, and we will be getting back to you with some answers. And see you next week.